Thank you for listening here today. My name is Lauren Johnson, along with Michaela Collis and Lori Labby. We have chosen to take an in-depth look at the company Meditech. Meditech started as Medical Information Technology Incorporated in Cambridge, Massachusetts in 1969 with a laboratory product. Meditech is now one of the most powerful electronic health record companies, or EHR vendors, globally, with a presence in some of the largest hospital groups. These include St. Joseph's Medical Center and Christus Health. Over time, many vendors have entered into the market and only 10 have survived. Meditech is one of the top 3 vendors in direct competition with Epic and Cerner. To stay one of the top EHR vendors, Meditech has had to adapt quickly, innovate, and join various sectors of the market while keeping with their mission and values. Meditech's largest presence is actually in Canada. Currently, they hold 41% of the market share and have the highest market share in Emergency Department Information Systems, or known as EDIS. Sales and marketing offer a full EHR suite to customers, but they do not have to buy every piece or application. For example, a hospital or doctor's office can purchase every application but cost accounting. On the organizational side, Meditech has grown to a company of 4,000 employees and was placed on Forbes' best mid-sized companies to work for list in 2016.
I have to pay attention to this. I can't.
Through an in-depth literature review of Meditech and the industry as a whole, we have developed this thesis, which will be the basis of our argument for this paper. Through an in-depth look at this company, we will uncover the management structure, strategic plan, human resources, meaningful initiatives, and financial status while exploring 2 key issues of the corporation, including the general resistance to EHR by doctors and hospitals, and the Meditech implementation model. As the company is evaluated, we hope to analyze and discuss Meditech's organizational strengths and weaknesses and provide recommendations for the future to keep Meditech a leading competitor in this industry.
As the company grew in size, various divisions developed. Within each, there are various teams and positions within. The executive board is run by A. Neil Pappalardo, the founder of the company, and is made up of CEO Howard Messing, Vice Chairman Lawrence A. Palomino, CFO, COO, and several executive vice presidents or vice presidents. The COO, executive vice presidents, and vice presidents lead divisions based on their backgrounds and previous work at Meditech. The divisions are constructed in a hierarchical manner with a chain of command. Here you can see a list of all the divisions at Meditech. Accounting is made up of traditional accounting areas such as cash and collections, accounts receivable, etc., along with payroll, benefits, accounts receivable, and travel. Many of Meditech's employees travel on a regular basis. Advanced technology focuses on software updates to customers, new technology, and the company's help desk. Client services focuses on service and implementation. Implementation works with new or returning customers to get their systems up and running. Services works with customers who have stable systems when issues occur. Product development fixes bugs in existing customers' applications, develops enhancements, and develops new products. Sales and marketing focuses on selling the product along with conducting external and internal education. Strategy division is one of the newest divisions at the company and works on Meditech's strategic plan, which will be reviewed on a later slide. Lastly, system technology focuses on systems performance, customer updates, and hardware specifications. Every division has a team for each application and takes a particular focus to it. As you can see here, we have drawn out a simplified diagram to show the hierarchy or reporting structure at Meditech. Associate vice presidents run portions of each division and report to executive vice presidents or vice presidents. Directors run teams of staff members that focus on one or more applications within a division and report to their associate vice president. Directors will have one or more managers or senior managers that report to them within an application. Underneath, the managers or senior managers include one or more supervisors. Lastly, underneath supervisors are various staff members that contribute to the success of Meditech, including application specialists, software testers, designers, marketing specialists, etc. I have labeled them all as lower staff members, but they're all full-time salaried employees that contribute to the success of Meditech and are essential for its success as a whole. As you can see, this is very simplified. There'd be more than one director, manager, etc. But for the purpose of this diagram, you can see generally how the chain of command trickles down from the top to the bottom. This is another diagram showing the same hierarchy flow, but in a different manner. The executive board is centralized, hence why it's bolded and in the very center of the screen, but branches are constructed from there. This diagram highlights one branch in particular, showing the flow from executive vice president or vice president down to a lower level employee. The board of directors makes many decisions on initiatives and sets standards of culture while the company maintains many middle managers in a chain of command. In this regard, Meditech is centralized because one central board makes large decisions that trickle down to the lowest level of employees. However, many of the higher managers are involved in day-to-day activities such as customer calls and completing tasks in Meditech's task workflow system. With managers, directors, and associate vice presidents working alongside the lower-level employees, there is a decentralized environment feeling since the lower-level employees can be involved in important decisions or bigger meetings. Meditech is mechanistic because of the centralized manner that sets the tone. There are many formalized procedures that staff are highly trained on and reinforced, but lower staff members and middle managers are specialized on one portion of the EHR. Although every manager has their own leadership style, many managers focus on coaching and participative leadership styles to encourage and develop staff members while considering emotional intelligence. Having the structure of Meditech allows for a balance of power, the involvement of employees in daily decision making, and keeps the board centralized to create a strategic plan. Since the creation of Meditech, the strategic plans have evolved in order to adapt to the changing industry. As a whole, Meditech agreed with many CIOs to implement key initiatives which aid customers in giving high-quality care to as many people as possible while being efficient and keeping costs low. Keeping this mission in mind, Meditech is devoted to providing productivity, patient experience, interoperability, and healthcare sustainability. EHRs need to aid in making physicians more productive for the number of patients they must attend to. With this, EHRs can no longer be cumbersome and unintuitive. Providing universal access to medical records through patient portals will aid the transition of care during the patient's journey and overall improvement of population health. Furthermore, as patients transition in care, interoperability is essential to allow real-time integrated systems and allowing physicians to receive all the correct information as providing quality healthcare is essential. Meditech is determined to offer their systems at a lower cost while providing the highest quality to make these systems accessible and affordable to healthcare organizations. Using these four strategic initiatives, Meditech can turn their goals into meaningful solutions.
As technology is always evolving, Meditech has implemented initiatives to create a more effective environment for users. Meditech has established development strategies that focus on advancements of products and partners with other vendors to power their products. Analytics, web EHR or web ambulatory, and home care are examples of new homegrown initiatives Meditech created that uses vendors to help establish efficiency across all aspects of the healthcare environment. Let me show you one that's even closer to your work downtown. The first initiative is analytics. Analytics is described as a new aspect or branch of Meditech that elaborates on the managerial and business aspect of healthcare facilities. With this new initiative, facilities are able to monitor revenue, expenses, and other statistics that will help with their decision making within their organization. It also creates and stores data about the facility and evaluates the successful aspect and evaluates the room for improvement within that facility. Web EHR, or also known as web ambulatory, is a cutting-edge on-the-go software that helps with the efficiency of physicians and patient interaction. This software is made for tablets and mobile devices to make easier for transport and for the efficiency of the facility. Meditech found that web ambulatory ultimately ends up cutting down on the number of clicks and the amount of time spent on entering patient information on the computer and spend more time with the patient. The last initiative for Meditech is home care. It is another initiative that extends to the post-acute services such as rehab centers, treatment centers, hospice centers, and allow them to have access to patient information that they normally would not have access to. This information that facilities now have access to can play a vital role in patients' quality of care. Not only does Meditech continue to further their success and progress with these types of initiatives that were just previously described, but the federal government continues to conform with their own initiatives to encourage the use of EHR systems among the healthcare industry. These initiatives aid in the quality of interoperability and quality of care. The federal government recognizes the implementation of EHR can lead to better healthcare decisions, a higher quality of care, and a reduction in overutilization. Certain initiatives such as the American Recovery and Investment Act, Meaningful Use, and the Centers of Medicare and Medicaid Quality Management can help in these areas. The next initiative is the American Recovery and Reinvestment Act, also known as ARRA. The ARRA was created in 2009 and focused on the EHR adoption. Under the ARRA, the Health Information Technology for Economic and Clinical Health Act, also known as HITECH, was established. This act is where the initiatives were put into place for the adoption of EHR. This was a key aspect of the ARRA that jump-started the expansion of the EHR industry. This only lasted until 2015, but when the initiative stops, facilities from 2015 on and did not adopt EHR were fined or penalized. Meaningful Use moves this process forward by creating goals that healthcare facilities must meet at a given time during the adoption of EHR. With this, Medicare and Medicaid EHR incentive programs were established to provide financial incentives to eligible professionals and eligible hospitals. These initiatives were provided for the adoption and meaningful use of EHR while remaining updated with the newest software and technology in order to improve patient care. If these eligible professionals and eligible hospitals are able to provide proof that they are meaningfully using their EHR systems, they are able to get money from Medicare and Medicaid in return. There are 3 stages to meaningful use initiatives. Stage 1 emphasizes adopting the use of EHR for information, data, and sharing. Stage 2 emphasizes the importance of policy goals, charge management reality, and clinical quality. The last stage, Stage 3, will then focus on how to improve the outcome of meaningful use. The Centers for Medicare and Medicaid Services discuss another government initiative that has been implemented called Quality Measurement. This is regulated by the Department of Health and Human Services and the Center for Medicare and Medicaid Services. These tools help implement initiatives to eligible professionals and eligible hospitals to make sure their quality of care to Medicare and Medicaid patients is up to standards. Healthcare facilities get rewarded for disclosing reports to the public and reporting certain aspects that the CMS requests. These are just some ways that the level of quality of care is measured and rewarded in order to hold facilities accountable for their EHR use. The main purpose of these initiatives is to increase the use and quality of the interoperability and encourage the use of EHR. Although Meditech and the federal government are progressing with initiatives for EHR efficiency and adoption as a whole, Meditech remains to be unique with their internal operations in their company. Aside from their unique breakdown and responsibilities for each division, Meditech also has a non-traditional human resource department. There are 4 major aspects of this makeshift human resource department, which include ombudsman, benefits, accounting, payroll, and recruiting. These divisions within Meditech Human Resource Department are unique in their own way and focus on different aspects of the company, such as recruiting and retaining staff, resolving workplace issues, managing benefits and claims, and paying salaries. Meditech recruitment system is also unique in that the majority of their employees were recruited through college fairs and referrals from other current employees. If current employees refer someone who ends up being hired and stays in the company for 3 months, that employee who referred them gets a $3,000 referral bonus. This is just one example of the distinct method Meditech uses. Meditech is a mid-volume EHR company that sells their software and services to mid-volume healthcare facilities. Financially, Meditech is not to the standards of Epic because they're not on the same scale of volume as Meditech. In 2012, Meditech had a significant influx in revenue due to the ARRA and the initiatives that were put in place for facilities to upgrade their systems. Their net income in 2008 was roughly $35 million and increased in 2012 to roughly $130 million. This is a significant increase which could be the result of the ARRA in 2009. After the influx and the initial adoption of EHR, Meditech's net income decreased in 2014 to roughly $123 million and decreased even more in 2015 to $70 million. Despite the decline in income, Meditech is slowly trying to regain momentum. Overall, Meditech is a conservative company which makes this process slower than competition.
The issues that we're going to cover today include general resistance to EHRs that continue to be a common theme across the healthcare industry, and Meditech's implementation model. Throughout the healthcare industry, adoption rates of EHR systems are low. Major barriers that hinder the resistance of EHRs include purchasing and maintenance costs, loss of productivity, adequacy of training, finding EHRs to meet practice needs, not being user-friendly and also being time-consuming, the lack of interoperability, which is the communication between one system to another, patient privacy, and spending more time on the computer than with their patients. Meditech's implementation model is a process that's used for every product that's sold. Their model is called READY, and it stands for Rapid Adoption, Evidence-Based Content, Advanced Workflows, Dedicated Teams, and Your Success. As mentioned earlier, Meditech is divided into different divisions that specialize in one aspect of the entire product as a whole. When thinking about implementing their product using this method, it can create issues. It can cause excess work for both Meditech employees and buyers. Buyers often have to deal with the number of specialists if questions or issues should arise with the software that they bought from Meditech. Resistance to EHRs impact the entire information technology industry, with a number of reasons as to why providers are reluctant to adopt EHR systems. Price is the primary concern. In order to face this, Meditech offers products at a custom price. They build their price of their product based on the number of beds and revenue the potential buyer generates. In order to face interoperability, Meditech also provides continuity of care documents. These CDCs include information about a patient that can be printed or transmitted electronically, where patients can bring these forms for future appointments with physicians outside of the system. Since there are low adoption rates for long-term care facilities like hospice, Meditech created a new initiative called Home Care that we mentioned earlier, and it provides information to long-term care facilities about patients that they normally wouldn't have access to. Meditech is also trying to reduce the number of clicks and is also making software more accessible, like the web-based initiatives that we also mentioned earlier. Meditech is also employing physicians and nurses to help with product design in order to create a more user-friendly environment. Meditech remains to keep up with advancements of technology by creating more initiatives to try and address the remaining issues of EHR adoption. Meditech's specialized feature allows for better knowledge within a certain aspect of the product if questions were to arise from buyers. This feature also allows more ideas and creativity to foster, with more employees being able to bring their thoughts forward. And in return, this leads to more innovations and better products. As I said earlier, this implementation model that they use can lead to more work for staff and buyers and can also be very time-consuming. Meditech tackles this issue by providing each facility with a direct liaison or contact to answer questions that buyers might have or help direct them to the people who can answer their questions. We provided recommendations to healthcare facilities and Meditech in order to improve EHR adoption. For healthcare facilities, it's important for management to stress the benefits of having an EHR system. They should also properly train everyone and be patient, especially with physicians who find these systems harder to use. They need to further educate their staff and stress the importance of patient privacy and the penalties of HIPAA violations. They also need to make sure that physicians and nurses still have time to focus on treating patients and not wasting it on the computer. Recommendations for Meditech include advertising their product while being honest in what their system will achieve so that buyers are not disappointed with the actual results. This can be achieved by traveling to facilities and pitching their products, or they could observe the facility's work environment first and then explain how their product could help create a better workflow. Meditech could also offer free trials to potential clients, and it's also recommended that they should maintain similarities across different versions. We believe that Meditech should keep their specialization strategy but change the way they employ their systems to buyers. They should have a team that's knowledgeable about the entire system and able to answer any questions. They should also be responsible for implementation endeavors and any follow-up questions or maintenance that could arise from buyers. Currently, Meditech is exploring this option, and it's called SaaS, or Software as a Service. But if Meditech were to implement this, it would be called MaaS, or Meditech as a Service. And with this, buyers would pay a monthly fee to license the software, and Meditech would ultimately be responsible for servicing and maintaining each system that they sell.